my patients were obviously questioning why I was doing this, and I didn't know if the answers that I had in my mind would resonate with them. I'm not sure how much the general public understands the pressure that a doctor has in their day-to-day life. I think that the reality is what we all know it to be who are in this business. But I think the perception is that we're well-to-do and privileged and have everything we want and drive fancy cars and all this stuff. So saying to my patients, I'm so stressed, I can't work this hard anymore, or I get up at 4 and I get home at 6, that at 4 a.m., 6 p.m. They probably wouldn't care so much about that. But I think the message that I gave them was that I wanted to be able to do more when they came in to see me, that I wanted to have more time to be able to advocate for them and be able to help them get the care that they needed, reach out to specialists directly while they were in the office to help smooth a transition or a consultation. When I had my event, I also talked to them about the importance of preventative health, and that takes time, to really go through all the preventative measures that we need to make sure our patients are getting. And I wanted to make sure that I had more time with them to explain things, make sure they understood what my treatment plan was and why I was embarking on that plan. And I explained to them also at this event that so many of the illnesses that they struggle with are completely preventable with the appropriate amount of time and counseling to explain to them how to prevent them. And when you're on a 10-minute, 20-minute schedule, you're basically checking a blood pressure, sending them for lab work, listening to their heart and lungs, making sure nothing horrible is going on, hopefully getting them to take their pills and seeing them back in 3 months. With a concierge kind of practice, and again, this is sort of how I was explaining to them, they would immediately notice that the appointments were not very hurried, that they'd have time to ask questions and have them answered fully and succinctly, that they would be able to call me whenever they needed me, that they would have access to my cell phone. And that, I think, did resonate with them. So I was careful in crafting that message to my patients so that it wouldn't be about me, but it would be about them and how this would be beneficial to them. And I think that's the most important thing when you're in any kind of a dialogue with someone and you're trying to come up with, common ground. It's unusual for that person to care about what I'm feeling. They're more caring about what they're feeling and what they need. And so that's why I kind of explained it to them from that perspective. Now, my patients who maybe understood a little more about what was going on or what is going on in the practice of medicine immediately said to me, "We're so happy you're doing this. You need to do this. You're a great doc. You need to do this for yourself, and we completely understand. We're with you 100%." And that was nice to hear, but I wasn't expecting to hear that. It's just nice when you get that back.